I'm Mike Maddux, pitching coach for the Texas Rangers. My eyes, they've seen a lot. Curveballs, fastballs, championship dreams.
The Texas Rangers win the World Series!
When cataracts started dimming my world, I knew I needed help. I founded a Tylock, Georgia Eye Care Center. Their team introduced me to RX Sight light adjustable lenses. Lenses that could fine-tune after surgery to fit my life. The doctors, the staff, they listened, cared, and walked me through every step. Now I see every pitch, every movement with clarity I didn't think was possible. Tylock George didn't just give me my vision back, give me my edge.
Okay, tell me who you are, where you came from, and what you do. Maddux.
Mike Maddux, grew up in Las Vegas. I'm the pitching coach of the Texas Rangers, and love to golf, love to hunt, love to fish, love spending time with my grandson. So life's been good.
Yeah. Okay, so what kind of hunting?
Anything that flies, or occasionally one that runs in front of the rifle.
Okay. The easy targets. All right, what about fishing? Is it fly fishing or rod fishing? Is that
we like to go bass fishing, really anything that bites, but it's all catch and release.
Okay.
Done a little fly fishing over the years. Not that good at it, but pretty better at going bass fishing, especially around this part of the woods, get some private water. Do a lot more catching than fishing. I would say I'm more of a catcherman than fisherman. Catch is a lot more fun.
Have you ever eaten anything you've killed?
Yes.
Okay.
Yes, sure have.
Details?
If I take down a mammal, you know that, yeah, you're gonna eat what you shoot. Okay. So, it's all about the processor on that one. So, happen to have a good one up in Roanoke. It's all good. Brats and sausages, jerkies, cut up any way we want.
All the fun stuff. Okay, so I would assume that your vision is very important, not only in your job, but also too in the hobbies that you mentioned.
Oh my. Love to golf. And it's nice to see your shot.
That ball's pretty small, isn't it?
Well, there was a moment where, I would have to ask my playing partners, where did it go? Because, my vision went to about maybe 100 yards on a good day. And I didn't really know it, And now, oh my gosh, I didn't realize I could hit such poor shots.
It's a blessing and a curse, right?
Yes, it is.
Why the decision? Why did you decide to have your vision corrected? Why did you decide that now was the time to do it?
I tell you what, in spring training, I haven't been able to really play catch for the last couple years, but this year in spring training, trying to participate in a drill, and one of the guys threw the ball to me, and I just flat missed it, and it hit me in the leg. And I was like, this is almost getting dangerous now, that I can't participate, can't see the spin of the ball, I can't see the flight of the ball. I play golf, I don't know where my ball landed, and it was time to do something.
So I went through a similar situation, and I had LASIK, 17 or 18 years ago, Tylock George, and I thought that was it for me. And I knew that it was going to, quote unquote, wear off at some point, but I thought that was it. Then I was just going to have to be, in readers the rest of my life. And then I've visited with, the folks at Tylock George, and they informed me that there were, many other options, which is why I decided to pull the trigger on it. I was tired of reaching for those readers and all those different kind of things. Can you take me through kind of the education process that you went through? And did you think that this just is what it is? We're getting old, and we're just going to have to live with it?
Always try to defy age, that we always feel up like we're bulletproof. Tylock George came out and was giving us an examination in spring training. And I've had these exams before, and it's kind of a quick, they look in one eye, they look in the other eye. But in this case, it was they look in the eye, and he was there for a while. And I'm like, something's wrong here. And then looked in the other eye for a little bit and came back to the other eye and was there for a while and said, you know what, you need to come in. And I went in and realized that my cataracts were fairly thick and they needed to be gone. For the last 5 years, I have not been able to wear sunglasses. I couldn't see through them. And just the walking around on the edge of, I wouldn't say blind, but, I couldn't see like I wanted to see and didn't really know why. And Tylock George informed me why I couldn't see and gave me the options of the procedures that we could do to correct that. And once I was educated on that, I would all in. I said, let me get back to where I can participate in these drills, watch the game. Remember this year early in the year before the procedure, we were in Cincinnati, and every time the ball was hit, I thought, where'd it go? Where'd it go? Where'd it go? Where'd it go? And I could never see the ball come off the bat. And at that point, when we're sitting there trying to read swings and see the flight of the ball and, how the hitter's reacting to the pitches, it put me at a roadblock of, what I do. This game has been the eye test for so long. Now we have technology that kind of helps with some movements of the ball and flights of the ball. But, it's seeing it at game speed is really the most paramount thing that we can have.
Yeah, and you're old school. You don't want to rely on that stuff. You want to see it with your own eyes. You want to see the movement of pitches. You want to know, how a ball is breaking, what one of your guys is throwing, and how well he's throwing it, and what it's doing. That probably pained you to not be able to do those things.
It was bad. It was bad. Where I could, if I was static, I could see it go into home. And I could see the movement, but once it got hit, the contact was made, I could not follow the ball. It was too fast for me.
One of the things I was so impressed with Tylock, George, everyone there from start to finish was that the informational, the educational process that they take you through. Because it is a little terrifying to have someone, basically cut your eyes open. You're like, and so you want to know exactly what's happening, what the process is going to be, what the recovery time is going to be. What was your experience like that?
It was fantastic. I went in there, I met with the team, and they walked me through this procedure and showed a video. And the video, I'm quite kind of scary, because I'm like, man, they are cutting your eyes and they're taking out your lenses, and then they're going to put in these synthetic lenses and you're going to be able to see. And I'm like, really? How's this going?
Yeah.
Modern medicine's unbelievable. And then there was the options of multiple options of which kind of lens that you could get and what were available. And as we talked about it and we looked at the way of light, the activeness, and all the dynamic vision that we need, between trying to see a baseball, a pitched baseball, a batted baseball, a foul ball coming in the dugout, which, happens fast.
Oh, yeah.
You can't see it. I mean, I've been hit a couple times. I've been nailed a couple times, and it's not fun. But if you don't see it coming, you're at God's mercy right there. So anyway, we walked through all the things and, like to hunt, like to golf. And I said, I'd love to be able to see way down there.
Mm-hmm.
I don't mind wearing readers. I'm okay with that. And then there were options that said, well, we can do both. And I said, well, explain those. And they explained them all the way through from A to Z. And it's one of the best things I've ever done is get my eyes back where I can see. I see the ball come off the bat. I'm a better coach. I play catch. I get involved with activities. I can do the things that I could not do for the last 4 or 5 years.
Yeah. And how, I guess, the pun intended, eye-opening was it post-surgery compared to what you had been dealing with leading up to it?
First thing I noticed was the colors were so brilliant. You drive down the road, the trees are greener, the sky's bluer. It's a beautiful country that we have, and just a beautiful world out there. And I had been missing it. And the panorama, the peripheral vision, I can't believe them. I can see out the sides. It's amazing just how well the improvement is unbelievable. I had no idea. That the cataracts and the visions that we lose, they happen so slowly over time, you really don't notice it. And then all of a sudden it was like, boy, somebody turned the lights on. Just a fantastic experience. And just going from the procedure to the follow-up and the availability of Tylock, George, here's my numbers, call if you have anything. It was almost like a concierge service, and it is a concierge service. It was just fabulous. It was easy as could be, and the utmost confidence in the positions there. And Dr. Nasser did a great job. I'm just so grateful to have my eyes back.
Okay, so I've got to know, when you make those mound visits and you put your hand on that shoulder and you cover your mouth like you do, it's like your signature move. Are you able to see your players more clearly?
I'm telling you what, man, I can see every whisker the guy has. It's amazing that the textures that you can see is amazing. Yeah, I never realized that. Looking down at my putter, I always thought my putter was shiny. I didn't know it was matted. It's a matte finish on it, and the grains of grass you can see. And then I walk out to the mound and I see the guy's whiskers. I see the drops of sweat, and I realize what a handsome young man this guy is. here we go. I'm able to read swings a lot better, and just the advice you can give them at game speed, it has made it so much easier.
Well, Maddux, I think we both made a good decision.
We did.
Up top. Well, Maddux, at the end of the day, we're just a couple of baseball people. I think we should bring in an expert to talk to us a little bit more about what was done to your eyeballs. And who better to talk about that than the guy who was in charge of your eyeballs for a period of time, Dr. Taj Nasser. Dr. Nasser, thanks so much for being with us. What was your experience like with Mike Maddux, and is it different with every patient?
Thank you so much, Emily. Really glad to be here. Thank you so much, Coach, for taking the time. It's really custom made depending on which milestone you're in. And, as a cataract and refractive surgeon, it's our bread and butter at Tylock, George. So we specialize in getting people out of glasses and contacts, regardless of what age group we're in. And there are many different options. So, patients who come in wanting to get out of glasses in their 40s where they really don't want to deal with reading glasses and they don't have a cataract yet, we can do a refractive lens exchange. Then you move on and you develop a cataract where things just become fuzzy at all distances. And that's when we can do the same kind of procedure. We take the natural lens out, whether it's clear or it's a cataract, and we replace it with the synthetic lens that the coach was talking about earlier. And it is fantastic technology where patients are able to get back to their normal activities with very minimal downtime.
And it wasn't just a one-time thing. They wanted to make sure everything was perfect for you.
It was over time, and I think that Dr. Nasser could probably explain it a little better than I can. I know I had the procedure, and then we had to let that procedure kind of heal, and then we went into the adjustable lens, the next stage up.
That's right. And that's what really sets apart the light adjustable lens from a lot of technology is, for the first time in history, we have lenses that we can change its shape after the surgery. So most of the lenses, you get what you see at the end of it without much adjustability or an option. So the way I love to explain it to patients, it's almost like a suit or a dress that you custom tailor after the procedure. And I remember one of our favorite moments was seeing Coach after the surgery, where he was like, Doc, I'm seeing really well. And I love that I can now see my fingerprints for the first time. And I was looking at Coach. I was like, wow, congratulations. This is awesome. This is a little bit better than we expected. But he's like, I'm when I'm golfing, and I love golfing, I want to be able to see the ball at 150 yards, not only 100 yards. And so for the first time in history, we can go back in and adjust it a little bit more, fine tune his vision more. And with one little light beam that's painless, he was able to come back the next visit with exactly what he wanted, which was great.
So what do you think about your fingerprints?
Well, the fact that I can see him is fantastic. I didn't realize that my vision was that bad until I could look down. I see my fingerprints. I can see the golf ball now. I can actually hit it as far as I can. The fact that I can see my ball land now, I'm going to start trying to hit it further.
Okay. Oh, yeah. Now you're going to start.
Yeah, now I'm going to try.
You weren't trying before.
Maybe that's why I hit it so short, is because I wanted to see where it finished.
Yeah, let me know how that works out. Now we know that light adjustable lenses can also increase your driving range.
Well, I hope so, because when we had the procedure, as Dr. Nasser was saying earlier, that once we had the lenses put in, and then I walked around for 4 weeks, and I could see my fingerprints. I could see things I couldn't see before. The colors, again, they were brilliant. But then I went out and played golf. I had to do the eye test now, and I played golf, and 150 yards. I'm like, wow, I can see that. And then 200, I had a bead on it, but I didn't quite know where it was. And then, so we went in, discussed, he dialed up that machine, and all of a sudden we zapped and we made the adjustment to what I needed to fit my lifestyle. And all of a sudden we went back out. I played golf. I could see the golf course. I could see everything. Unbelievable, the technology we have, the skills that Dr. Nasser has to improve my life, not only for what I do as a livelihood on the baseball field, but what I'd love to do, on the golf course. And I'm kind of looking forward to go and hunt and see if I need a scope or not.
So here's a question: what's the time frame we're talking about here as far as the adjustment period? I mean, it's 5 years from now. It's going to be like, yeah, you know what, my golf game's not that great. Let's dial it back a little bit.
That's a great question. So one of the benefits of the light adjustable lens is we can change its shape, but we don't want to continue to change its shape, whether we can help it or not. It's sensitive to UV light, so it uses little light beams that changes the shape of the lens, and we don't want patients to be out and about in the sun and continue to have their lenses change shape. So we do a couple of adjustments. couple of weeks after procedure. It's about 90 seconds or less. The treatment is painless, and we're able to change the shape of the lens and then lock it in so it doesn't continue to change afterwards.
So I guess who would be a candidate for the light adjustable lenses like Mike has?
Yeah, anyone who wants to get out of glasses or contacts if they're in their second or third milestone. So what happens is our natural lens with time becomes more rigid. So it's not as flexible as it was when we were in our 20s and our 30s. And patients who want more range. So, I love my distance, but I kind of don't want to wear reading glasses. We can replace the natural lens with the lens adjustable lens. So if you're in your 40s or older and you're struggling with activities of range, whether it's distance or near, the light adjustable lens could be a great option.
And I hear this a lot in my visit with you and with Mike as well, the term milestones. Tell me what those are.
Yeah, great question. So when you're in your first milestone, that's usually in your 20s and your 30s, your eyeball stops growing. And that's when your vision is stable. So you could be nearsighted or farsighted, depending on how large your eyeball is. Then you move into your second milestone, which is the lens. So the intraocular lens inside your eye is very flexible. Once you get into your 40s, it becomes more and more rigid. So that's why you have to push things further and further away for you to be able to read. Then you lose real estate and you need a pair of readers. So that's at age 40. Then eventually in your late 50s, the natural lens, not only does it become more rigid, but it actually becomes more opaque. So your all range of vision becomes more and more cloudy. So that's what Coach was going through. It was, it's becoming more dangerous for my lifestyle. And because both his distance and his near was getting impacted. What we could do is we can restore that by removing the cataract and putting an artificial lens, the light adjustable lens. And that's a permanent solution for the rest of his life.
Yeah. And what does it do for you? I mean, you're a doctor, you're a surgeon, like you got into this field to help people. But when you hear stories like Mike's and like mine, and you see the impact that it has, how gratifying is that for you?
It's amazing. It's a dream come true for me, a privilege and honor. I can't play as good in golf as Coach, or definitely not hunting either. So I'll probably get some lessons from him after this. But to be able to hear that, every waking moment of your life, when you get up, when you look at your watch, when you're enjoying your grandkids or your daily lives, it's immense gratitude. It's something that it's easy to take for granted sometimes. But every day, I'm just so thrilled and honored to be able to be granted the privilege of taking care of, one of the most guarded senses we have.
And Maddux, were you like me? Did you think this is just part of getting old and I'm just going to have to suck it up and deal with it?
I've been going on that for a while. I thought that, I've been wearing glasses for the last 30 years. And I just thought that was part of my life. And that was always going to be the thing. You wake up in the morning, you want to see what time it is. You got to reach for your glasses to see your wristwatch. That was just normal for me. But then, that was one of the greatest things that ever happened was Tylock and George coming out to spring training and actually letting me know that this was correctable, is correctable, and has been corrected. And now it's like a breath of air. It's to have your eyesight back the way it used to be. You can enjoy life a lot more. It's things we take for granted, when we wore glasses, or we didn't take for granted, I guess. We needed our glasses to function. And now it's, you wake up in the morning, you walk outside, it's see the beautiful world that got created, and everything is fantastic. I can't thank Tylock and George and Dr. Nasser enough for giving me that 3-dimension, the high definition that I see every day now.
And I like to think of us as seasoned, not old. We're just some of us have a little more seasoning than others. Well, Dr. Nasser, Mike Maddux, thank you so much for being with us. This was fun. Appreciate you guys.
Thank you so
Appreciate
much.
you.
It's a privilege and honor to get to take care of both of you, and we really appreciate the support. Congratulations on your new vision.
Thank you.